Hi, I'm Charles Warman. I'm one of the physical therapists here at Waterloo Sports Medicine, and this video here is going to be talking about basic back squat technique. So the first point that we want to look at is making sure that you have a normal and full range of motion in your hip. So this is just a self-assessment for checking out how does the hip move and what position does the hip like to move before the pelvis starts to rotate, which would affect your lower back. So laying flat on your back comfortably, you can just bring the knee up and just kind of move it around side to side and just feel where does the hip want to go before you run out of room. And then essentially doing with both legs, it should look like a squat from the floor laying on your back. And that's your angle, that's the depth of your squat that is going to be ideal for you. So if your hip anatomy doesn't allow you to go further, that's as deep as you can comfortably squat. The second test is going to be in a 4-point position and coming back into the same movement. How far can you go before your back starts to round? And again, it should be the same depth. And you can move your hips a little bit wider, a little bit closer to get the feel for what is the ideal depth and position for you and your anatomy. So now that we have our depth, you can test out foot position. So if you're a bit too narrow, you won't have much room and you won't be able to comfortably squat. If you're way too wide, your flexibility may limit, again, how far you can go. Getting into a comfortable position should allow you to get down into your squat the same position as if you were when you were laying on your back or in that 4-point position. And then you can do a couple comfortable squats in that position to be sure that that is a comfortable foot position for you. Now this foot position should allow, when we're squatting, for the bar to travel through a path that is halfway through the length of your foot. So the bar at the bottom of our squat should travel through, if we drew a line vertically, that bar path should travel through the midpoint of the foot, which roughly corresponds with your laces. So a common cueing mistake around chest position is lots of times people want to keep their chest up. The reason why they say keep the chest up is so that you don't end up bending forwards or flexing the spine, but oftentimes keeping your chest up causes you to bend more at your knees, and that cue doesn't allow you to go deeply into your squat. That causes a lot of anterior motion of the knees, which puts a lot of stress and strain through the knee joint, and it really limits how far you can go without bringing those knees even further forward. So it's better to try and point your chest towards the floor, keeping your back tight, but more thinking angling towards the floor. So that allows you to get into a deep squat, into that deep hip angle, without putting a lot of stress on your knees, right? Pointing the chest towards the floor as opposed to forwards will put the knees into a better position and allow you to more effectively utilize your hips. A second common cue that can be quite effective is to help engage the hip abductors and external rotators. So thinking about trying to push out or spread the floor. You're not going to be turning the legs out, you're going to be just thinking pushing out. So your feet are rooted and you're trying to push out, really engaging the hip musculature to stabilize the knees and help power you up out of that squat. So the next cue you want to be thinking about is where you're looking, or head position. So oftentimes people always say look up, like look to the ceiling, or look above you. Now again, the reason why that is so that you don't end up bending forwards, but putting your head in that position puts a lot of strain on the neck as well, and it's not a natural position for your spine to be in. So if you're looking up, it actually inhibits your stability and puts a lot of strain on the neck. So it's better to look straight, or keep the chin tucked is a better position. So keeping the gaze fixated roughly forwards or towards the floor will help with that chest to the floor position, and again keeping a more neutral spine. So I don't want to look down at my feet, because again, if I look down, my body will flex. It's more looking forwards and down. And of course, you do not want to be looking side to side or looking around with a heavy load on your back, because that will end up putting a lot of stress and strain through the neck. So some common mistakes are when you're trying to keep your chest a bit too upright, and you end up having more of a forward translation of the knees. So as the person goes down, they try to keep too upright, and they end up shifting forwards. The bar path is now much more forwards. More weight is on their toes, and they're having to utilize their knee extensors more extensively. Now, the second common mistake with squatting is almost the opposite, where they're going too far forward and turning the squat into more of a what we call a good morning exercise, or a pure back extension exercise. They are not bending their knees enough and bending almost exclusively through the hips, which then creates a large shearing force through the back. So our third mistake is going too deep into the squat. At the beginning, we talked about how your anatomy can limit how deep you can squat. So if you try and go deeper than that, you're gonna have lower back flexion, okay? You're gonna have rounding of your back. You wanna keep a tight, neutral spine and only go as deep as you anatomically can. The fourth mistake we commonly see is where someone drops down into a squat and then coming out of the squat, they turn it into, again, more of a back extension exercise. They extend the knees too early and then extend the hips afterwards, which again is not an ideal squat technique. It's a good back extension exercise, but when you use a lot of load, it can create problems for squatting. So the fifth common mistake we see is person drops into the squat ideally, but coming out of it, again, is cued to lift their chest or keep their chest up. So then they end up extending through the hips too early, driving the knees forward. You want to think about trying to have a symmetrical motion and keeping your back angle the same as you come up out of the squat.